Now let's see something more detail of the peritoneal cavity. As we already discussed in the previous video of the general consideration of the peritoneum, this peritoneal cavity was a very large serous sac before invagination of the organs and the viscera, but after invagination of the visceras, this cavity becomes narrow and irregular. Along with this, due to the fusion of the visceral and the parietal layer or visceral and visceral layer of the peritoneal cavity, it becomes very complex. To understand the complexity of the arrangement of the peritoneal cavity, we have to know the exact location of the visceras and GI tract. So here in this case, we can appreciate that this is the liver, here this is the stomach, here this is spleen. As we already discussed, the spleen is situated on the left side to the stomach because it is going to derive from the dorsal mesogastrium. Here just below and behind the stomach we can see this is the transverse colon, and on the both side of it this is the ascending colon and this is the descending colon. Here the loop are the small intestinal loops, and with the continuation of the descending colon we find that this is the sigmoid colon, and in the midline this is the rectum. In front of the rectum, in case of female, there lies uterus, and in front of the uterus there lies urinary bladder, while in case of the male, just anterior to this rectum, urinary bladder is situated just behind the pubic symphysis. Behind the transverse colon we find the retroperitoneal organ, that is the pancreas, and the kidneys are also retroperitoneal in nature. With the difference of the development and the rotation of the GI tract into the abdominal cavity and the complex arrangement of the visceras, peritoneal cavity becomes more and more complex, and this peritoneal cavity is converted into two sacs. One is the larger one, that's why it is called as a greater sac, and another one is the smaller one, that is called as a lesser sac. And both these sacs are interconnected with each other with one foramen. That foramen it is called as the foramen of the Winslow, or it is also called as epiploic foramen. So here we can imagine this balloon. So this is the image of a single balloon which is converted into two sacs. One is the greater sac, that is the larger in size, and this one is the lesser sac which is little bit smaller in size, and both are connected with each other through this foramen, and this foramen it is called as the epiploic foramen or foramen of the Winslow. Now here is the image of the sagittal section of the abdominal cavity, and here we can appreciate the arrangement of the visceras in the sagittal section. So here in this figure, this is the liver, this organ which is situated just below the liver, and just behind to it this is the stomach. Just behind the stomach and just below it we find this is the transverse colon. On the posterior side this is the pancreas. Here all these are the loops of the small intestine, but for the practical purpose we have shown only one loop, and this is the loop of the small intestine. Just below, just above the pelvis, we find this is the sigmoid colon. Here we can appreciate this is the rectum. In case of the female, just in front of the rectum, we find the uterus. And in front of the uterus, this is the urinary bladder. Now for the orientation of the greater sac as well as the lesser sac, let's trace them vertically as well as the transversely. First of all, we are going to see the greater sac, but along with the greater sac, we have to also orient with the lesser sac in a very brief manner. And afterward, we are going to discuss the lesser sac in more detail. So for the orientation of this greater sac as well as the lesser sac along with the epiploic foramina, let's trace the peritoneal layer vertically, and then we are going to trace them horizontally. Now starting from this umbilicus, let's start the parietal peritoneal reflections over the anterior abdominal wall. So here this is the parietal peritoneum which runs along the anterior abdominal wall above the umbilicus and it reaches up to the liver, and now it becomes visceral layer. So this visceral layer, it is going to cover the superior surface of the liver and it is going to fold it on itself and going to cover the inferior border of the liver to reach up to the stomach. So this layer, it is going to cover the anterior and the superior surface of the stomach, and it is going to form the part of the lesser omentum, which we are going to see shortly. After covering this anterior superior surface, this visceral peritoneum, it is going to fold in the abdominal cavity and going to form the four folded layer. Out of them, the first and fourth layer, they are in the continuity with each other and going to form the greater omentum. After forming this greater omentum, this visceral layer, it is going to cover the inferior surface of the transverse colon, and then it is going to cover the posterior abdominal wall, and now it becomes parietal peritoneum once again. Now again this parietal peritoneum, it is going to suspend the small intestine and going to form the visceral peritoneum, and which is going to cover the small intestine and forming the mesentery, and this mesentery is the suspending fold of the small intestine. Here for the limitation we have shown only one loop of small intestine, while there are so many loops of the small intestine are there which having the mesentery. Now again this visceral layer, it becomes parietal when it reaches to the posterior abdominal wall and it runs along with the posterior abdominal wall. As it reaches up to the sigmoid colon, this parietal peritoneum again is going to form the visceral peritoneum to enclose the sigmoid colon and going to form the sigmoid mesocolon. Now again after reaching up to the posterior abdominal wall, this is going to form the parietal peritoneum. Now this parietal peritoneum, it is going to form one fold between the rectum and the uterus in case of female. This is called as a recto-uterine pouch, and after covering the uterus from its superior surface, it is going to form one another fold between the uterus and the bladder, that is called as a uterovesical fold or vesico-uterine fold. Now again after covering the superior surface of the bladder, this visceral layer becomes parietal and going to reach up to the umbilicus. So this whole sac, which is going to cover the anterior surface of the stomach, greater omentum, the transverse mesocolon, mesentery, sigmoid mesocolon, recto-uterine pouch, vesico-uterine pouch, this whole sac is a greater sac. Now let's trace one more sac which is situated behind the stomach, and this sac, it is the lesser sac. When we trace this lesser sac, the visceral peritoneum layer, which is going to cover the surface of the liver, which is going to continue as the posterior layer of the lesser omentum and going to cover the posterior inferior surface of the stomach, then going to continue as the second and the third layer of the greater omentum, and this lesser sac, which is after going to form the second and third layer of the greater omentum, which is going to cover the superior surface of the transverse colon and continue as the superior layer of the transverse mesocolon, and it is going to cover this pancreas. So pancreas, it is also covered with the lesser omentum. Now after covering this pancreas, this visceral layer of the lesser sac, it becomes parietal and going to cover the body wall, which is going to continue with the visceral layer of the lesser sac over the liver. So the small sac which is situated behind the stomach, that is called as the lesser sac, and the larger sac which is situated in front of the stomach, that is called as the greater sac in nutshell. So here in this figure, this is the lesser omentum. And here the greater sac and the lesser sac both are going to communicate with each other with this foramen which is situated just below this lesser omentum, and this foramen, it is called as the epiploic foramen.